dealing with chronic shoulder pain that was diagnosed as a winging scapula, tried all the exercises to fix it, only to have the problem continue to get worse. Tired of being in constant pain and unable to do the activities you love? Then this video is for you. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a chronic pain treatment expert with over 15 years of experience, specifically for headaches, neck, and shoulder pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain without the use of medications or injections. This leads to a big increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick disclaimer before we get started. I make these videos not to entertain, but specifically for anyone that has been dealing with chronic headaches, neck, or shoulder pain for at least 6 months. They've tried just about every type of treatment, and they've been lied to, overpromised, and underdelivered by the current medical model in hopes of giving some real answers to what is going on and get to the root cause of the problem to get some long-lasting pain relief finally. I want chronic pain sufferers to be properly educated on all their options for treatments and be able to fully make an informed decision about how to get out of pain and get their quality of life back. Now on to the video. All right, let's get into the video. This week's question came from Miles on YouTube. The question was, I've been dealing with pretty constant shoulder pain for going on the past year or so. I had an MRI done, and all it said was I had some bursitis and inflammation in the joint, but no cartilage damage or issues with the rotator cuff. I went to several physical therapists, and each one diagnosed me with a winging scapula, and it was clear to see through the photos and videos they showed me. Each one of them had me do a bunch of different corrective exercises like push-up plus and wall angels, but the winging stayed there, and often the exercises made the pain feel worse. The only time I got any relief for more than a few days was when one of them dug in on my rhomboids with their elbows. It hurt like hell, but it did help to correct the problem for a week or so, but it also came back. Do I really have winging scapula or something else that they are all missing? Thanks for sending that question in, Miles, and I'm going to do my best to try to answer it. Just a quick reminder, if you do have a chronic neck, shoulder, elbow, or wrist issue, been dealing with it for at least 6 months, haven't got any real answers, you can send your question in directly to me, and if I think my insights can help, I will be sure to make a video for you to address that. All the information to do that is in the description box below or wherever you're watching the video. So let's get right into it. So what am I going to cover in this video? First, I'm going to cover why does winging scapula happen in the first place. Next, common treatment methods and why they don't have long-lasting results. And lastly, how our providers trained in the PEAK method approach the problem to help get long-lasting pain relief. So basically, how does this all happen? What causes a winging scapula? So I talk about this in a lot of videos, and the majority of what I find and do in my practice is finding and fixing adhesion, also known as scar tissue, and then the nerves getting stuck to the muscles. Basically, over time, with overuse, bad posture, repetitive motions, the muscles get constantly stretched and contracted. They don't get enough blood flow. They don't get enough oxygen. Then the body starts to lay down this stuff called adhesion. Our scar tissue, it acts like a glue that gets inside there. And the first thing it does is it makes the area less flexible. And then it makes it weaker. And it usually likes to start in the muscles. So when we're having a shoulder problem like bursitis and a winging scapula, a lot of times the adhesion starts to build up in the muscle in the back part of the shoulder, one of the 4 muscles of the rotator cuff. It's called the infraspinatus. It's on the back part and sits right on the shoulder blade. Is usually the one that gets the most amount of adhesion to start. The infraspinatus is really important in movement of the shoulder, stability, function, everything like that. And when all that adhesion gets in there, it just causes a lot of problems. Next area where that adhesion will also form is on the front part of the muscle of the rotator cuff in the armpit, a really big muscle called the subscapularis. It is the only muscle of the rotator cuff that stabilizes it from the front. It is a big and powerful muscle, and it also develops a lot of that adhesion as well. So it's bad enough that it gets stuck inside the muscles, but then eventually what happens is it does get caught to the nerve. and it creates what's called a nerve entrapment. Now, nerves do not like to get entrapped. It is one of the things that they really hate. Most nerves are built with about, I'd say, 15% of extra slack, like a rubber band, to allow them to get to where they need to go. What happens when all of that adhesion does form in the infraspinatus and also in the other top muscle called the supraspinatus, which is another one of the rotator cuff muscles? That nerve gets stuck, and it's called the suprascapular nerve. And the job of that suprascapular nerve is actually to move the infraspinatus and the supraspinatus, and it gets stuck in there. And when this happens, things don't function properly, which then turns into like postural issues where the scapula starts to wing out to unload that nerve entrapment, because the nerve entrapment does not want to be in there and the body does not like it. And it's like, hey, if we can't function normal, we're going to do it a little bit different. Then what it does is it actually gets caught inside the joint of the shoulder itself, this really big thing called the capsule. The capsule is really good at anchoring the shoulder, providing movement, stability, all that. Now, since the muscles aren't working correctly and the nerves are caught, the force has to go somewhere and it goes to the capsule. And that really starts to restrict the motion and the movement of the shoulder. It's also the main culprit for frozen shoulder presentation. I won't go into that in this video. I'll cover that in a different video, but then it gets into the capsule as well. So what happens? You got adhesion everywhere. It's building up everywhere. Shoulder's not functioning, not stable how it should be. So what does it do? It asks this muscle called the serratus anterior to kick on to help and help move the shoulder. And basically what it does is it pulls that shoulder out to help work around the compensations in the nerve entrapments, in the adhesion of the rotator cuff, and the adhesion of the capsule. And the serratus really isn't designed to be a primary shoulder mover, but it kicks on to help. And that's where the winging scapula comes about, because everything else is not working correctly. So, some common treatment options and why they don't have long lasting results: stretching. Stretching, the problem with stretching is it moves the tissue around, but it doesn't actually get rid of the nerve entrapments. It doesn't get rid of the adhesion or the scar tissue in the capsules and around the nerves. I say stretching is kind of like brushing and flossing your teeth. It's it's good, but if you have like a cavity or like really deep plaque built up in there, you need a special and focused type of treatment, and stretching isn't going to get that. So when you do stretch, what it does is it stimulates some stuff in the brain and the spinal cord and stuff like that, and things temporarily relax, and you get some improvement in range of motion, but it never really holds. Next is corrective exercises. This person was saying, they're doing all these like corrective exercises, push up plus, wall angels, and stuff like that. The exercises are fine, but the problem is the tissue isn't healthy. When you have all the adhesion and nerve entrapments, it makes it less flexible, and then it makes it weaker. Trying to do the corrective exercise to try to fix all of that would be like trying to fix a cavity with brushing and flossing. It's not going to get there. And a lot of times it can actually flare it up. And this is what Miles was experiencing when he's doing those exercises. It actually created more pain in the shoulder because that tissue isn't healthy. So you're trying to like load it even more. It's already getting overloaded. And then the exercises just kind of pushes it over the limit. Next is like foam rolling lacrosse balls and muscle smashing. I see this all the time on the internet of people showing how to fix and treat their own injuries. I mean, how's that working for you? Especially if you've been dealing with it for 6 months. I don't blame you, because most providers out there suck anyway, and they're not getting to the root cause of that. But basically, what you're doing when you're doing these things is you're just doing something like stretching, maybe a little bit more extreme, and you might get a little bit more time in between where it feels a little bit better, a little longer window. Maybe stretching's like an hour or two, where foam rolling lacrosse balls and smashing might be a day or two, which is it's nice relief, but it's not getting to any of the root cause of what's going on, because it's basically just stimulating some of those muscles and blocking some pain temporarily, but not getting to the root cause. And lastly, he was talking about this, when he got the treatment on the rhomboids, where they went in really deep with their elbow. I don't ever recommend using your elbow for treatment. You can't get any feedback. You just beat the hell out of the tissue. It makes it a lot worse. This one's helping a little bit more because it's stimulating those receptors in the spine and the nerves more than those other things. So that's why he got a couple of good days out of it, but it continued to kind of come back. The problem for all these is it's not an actual treatment because it's not removing the actual problem. So, how do our providers address the problem to get long lasting results? First, we start by addressing the cause, not the effect. A lot of times in the injury treatment space, even modern medicine, is we spend so much time going after the effect and not the cause. And basically, the wing scapula is an effect of everything else not working correctly. Like I talked about, it starts with the adhesion in the rotator cuff, then the nerve, then the capsule, and all that, and then it builds up. So that's where the actual cause is coming from. So we start there instead of going to the effect, which is the wing scapula. Next is we got to restore full range of motion and flexibility. And the only way to do that is fixing the adhesion and the nerve entrapments. Now, they can be fixed, they can be treated correctly, but most providers aren't very good at treating them because they need precision, they need focus, they need almost like a surgical type of feel, not actual surgery, but very precise and focus. And that's where I always say it's kind of like a cavity that needs like a very precise drilling and focus type of treatment, where all those other things are kind of like a dental hygienist trying to clean or like trying to brush and floss. It's not going to get there. So we really get in there and are able to find and fix those nerve entrapments and that adhesion and restore that range of motion. Then once we do that and the muscles are healthier and they're functioning better, then the corrective exercises work really well, because basically when we get rid of all the adhesion, we get the range of motion back, but we got to build the strength up. So the corrective exercises weren't wrong in this situation. They just weren't done at the right time. So it's really key about when you do that and how you do it. And unfortunately, in the musculoskeletal injury world, um, most go-to is like go to physical therapy to start. The problem is they shouldn't be the first person you see, maybe the last person after you go to a specialist that can actually clean up this tissue and get it functioning better. And then lastly, once we get all the range of motion back, we balance out the strength, then we're going to increase the strength with global movements. I go to more building up actual strength, like full shoulder movements. I do overhead carries. I do a lot of things to build that strength back up. So it's like get it moving better, then build that strength up in each individual muscle, then build up that global strength in the shoulder, the mid back, and everything like that. So when it's like following a process. I always say this is like building a house. We have to lay the foundation, then put the siding, then put the roof. The problem is we're trying to put the roof and the siding on before we ever lay the foundation, which is why people are getting lackluster results and not getting to the root cause of what's going on. You can't fix a problem if you don't know what it is in the first place. So if you're dealing with this problem, you need some help. We do have people out there that can help you. The best providers in the world for treating adhesion and nerve entrapments are trained in my system called the peak injury treatment method. And when you've had enough of constant, neck pain, shoulder pain, all sorts of issues in there, you can reach out to us and request a no charge shoulder pain consultation to get some real answers as to what is going on and on the path to long lasting pain relief. All the information to request that is included in our profile or wherever you're watching this video. I hope you got some good insights out of it. You learned something, got a different perspective, and that it helped you. I appreciate you watching, and we'll see you on the next one. Bye.